You are listening to Breaking the Waves, conversations about the Dutch pandemic. My name is Matt Cornell, and I started this podcast to be an English language resource for people who want a critical perspective on Dutch coronavirus policy. My guest today is Vicky van der Togt. Vicky is a communications expert and now researcher who was up until recently focusing on topics such as climate change, ethical supply chain development, and sustainable production. In March of 2020, she got sick with COVID and has been struggling with long-term symptoms ever since. In part because of this, she joined the Dutch zero COVID group Containment in July of 2020, and subsequently founded the International Zero COVID Alliance in August of 2020. The Zero COVID Alliance is an overarching platform that supports the COVID response efforts of 40 partners around the globe. Since March 2021, she's also part of the work group Long COVID Netherlands, PASC, that is advocating for recognition, research, and rehabilitation for long COVID in the Netherlands. Our conversation was recorded on July 8th, 2021. Well, Vicky, I would like to thank you very much for joining me on Breaking the Waves. And maybe we could start by just talking a little bit about your experience. What was the first wave of the pandemic in the Netherlands like for you? What was your experience?
Oh, wow. The first wave was sheer hell, to be honest. I mean, even before the first patient was confirmed in the Netherlands, I was already infected. So I got my first symptoms at the first day of March. And I didn't think much of it back then because my symptoms weren't really in line with the list of symptoms that were given by RIVM, so the Dutch CDC.
What kind of symptoms did you have?
I had weird, like, red patches in my face, and I kind of had like this tingling sensation. I was a little feverish, but didn't have a fever. I wasn't coughing that much. I was sneezing a little in the first couple of days, but that was really the incubation period. So at the 1st of March, I already had symptoms. So kind of like backtracking that, I was possibly infected around like 25th of February, and the first patient was confirmed on the 27th. So the first wave for me was basically, yes, laying in bed, recovering from initial disease. And that wasn't easy because my initial disease lasted around 3 months. I had double pneumonia. I got an actual fever after those first couple of days that lasted for quite some time. I had circulation issues, mostly in my legs, that really prevented me from walking properly. I lost a lot of muscle strength in my arms and my legs, basically everywhere. Muscle pain everywhere as well. That was really the first month. In the second month, I also developed heart issues. So I started having palpitations, and I couldn't really lay on my side because it felt like I was crushing my heart with my arms, kind of. And I had a rash over my whole body. So that was really the one thing that was really odd to me because it presented as shingles. Which was a weird thing for me to get because I had that 10 years ago, but it never came back. And I also didn't feel like my resistance was that low at that moment that it could just break through without there being another reason for that to happen. So that already sent off all the alarm bells. I tried to get in contact with my GP back then, but of course I wasn't able to go into the GP's office. So they had to get a diagnosis through WhatsApp images, basically. So I had to take photos of all the weird rash patches all over my upper body. And they misdiagnosed with another rash. So they gave me one type of antibiotic and a cream that both shouldn't be applied when it's actually a viral disease. It should only be used for bacterial infections, and so it made it worse. So it took about 3 months trying different creams, different medicine for it to kind of get a little bit better. And then in July, beginning of July, I was like, yeah, this is not great because, you know, first wave, you also know our prime minister went on TV on the 16th of March saying that everyone should get this and it only affects the elderly. And so if we have to let the virus run through the population, specifically through kids, then that is a great way to get herd immunity. And young people do not really have anything to fear from this virus. Well, I know I'm not that young anymore, but as a 29-year-old, getting that sick from this disease, I knew that what was being said by like the politicians in charge wasn't true at all. Like if I could have symptoms 3 months on, then anyone my age, possibly even younger, could have the same. So I kind of went on this quest to find out like how many people is this affecting in the same way that it is me. That wasn't so easy to figure out. So I started.
Sorry, just a question here though. So between March 1st, right, and July, when these symptoms were sort of developing and evolving, were you ever able to get a test to confirm an infection, or even like an antibody test to see if you had antibodies in your system?
No, they wouldn't do that because there weren't any tests during the first wave, or at least they said that there weren't any tests. We of course now know that that wasn't as true as they made it seem back then. But yeah, only healthcare workers, people with vital professions could get tested. And it was only I think it was the 1st of June that our Ministry of Health said that everyone could now get tested.
Oh.
But of course, I got infected in February, March. Like the PCR test wouldn't do any good for me. Like there's no way I would test positive on that after 3 months. But I still did it anyway. I was actually sent to a closed testing center. So they sent me to the ADO Stadium here in The Hague. And I already said when they sent me there, like, I cannot walk properly. Like it's quite a long walk. Are you sure that it's open? They're like, yeah, sure. Like this weekend, it's still open. It'll close after the weekend. Turns out it wasn't open. They sent me to an empty testing street and I basically managed to get there just barely and had to go back again because there was no like actual information of when the center would be open or not. Then after that, I managed to get a referral for an antibody test in the hospital, but I tested negative on antibodies, which isn't uncommon with long COVID. It actually happens a lot. And also the antibody tests are not as sensitive in women as they are in men. They're actually only 70% effective in women, if I remember correctly. So none of that was weird, but for healthcare professionals, like they thought that that was the ultimate measuring tool to see if people had COVID or not knowing that there are so many caveats to that. Mm-hmm. So from that point on out, I really struggled getting any care while still doing so poorly. I did manage to get some medicine for my heart, and I was referred to get all these tests done in the hospital, but really like generic tests. Nothing was actually focused on finding any damage done by COVID. Like you have certain CT scans that would be able to pick up on the damage that COVID does to certain organs, but I couldn't get those. I still can't, by the way. And how it was brought to me was that I could possibly get treatment, but only after I had done every single test in the hospital that they referred me to. But yeah, like so many other long haulers in my place, none of these tests showed anything. And so, yeah, after all these tests, they were like, nothing's wrong with you. Your blood work seems good. Maybe it's stress, maybe it's this, maybe it's that. Then there's the added factor in my personal story is that when I got sick, my dad also got sick. My dad had been suffering from Alzheimer's for over 10 years and was living in an elderly home. And when I was quarantining, like because I was sick, my dad was actually dying and I couldn't go there.
I'm sorry.
Thank you. So yeah, literally the day that our prime minister went on TV to say that everyone should get this, I was sat on the couch with 911 pressed in, basically waiting for things to get worse. And that same night, my dad died. And it was just like, it was a traumatizing day, like really. Because just hours before I was looking at that speech and basically thinking like, what can I throw at my TV because he's so wrong. Because of that, because I mentioned that once that my dad died during that initial phase, my GP decided to write that down in my medical journal. And later on, I found out that with every single hospital appointment, every entry into my medical journal started with patient recently lost her dad could be a reason for symptoms. Even a year in.
You mean it was put in your medical file to imply that maybe you were having these symptoms because you were traumatized by your father dying?
Yeah.
In other words, they were implying that these were psychosomatic symptoms.
Even when I rushed to the ER with another round of pneumonia, they had the guts to tell me that, like, they literally, when I walked into the room, they started with, "Oh, I see that your dad recently died. That's probably the reason why you have these symptoms." And I was like floored. I'm like, really? You're trying to suggest here that I'm suffering from pneumonia because my dad died over a year ago? Like, really? It's just,
I hear a lot about medical privacy in the Netherlands, but it amazes me that something like that would follow you to all of your appointments,
yeah.
And inform the kind of treatment you're getting.
And also no way to get it out, because I cannot change the entries. I cannot make anyone change that. So it's in my medical dossier forever.
You mentioned that this was making you feel pretty isolated and probably questioning, what am I going through? But you said that eventually you were able to connect with other people who were having similar symptoms. Can you talk a little bit about how you were able to find a community of people who are having a similar experience?
Yeah, honestly, all of that happened online. I started speaking out in the beginning of July, basically writing this whole Twitter thread saying like, look, I'm only 28 at the time. I described some of my symptoms and I got a lot of responses on that from all over the world. I did it in Dutch and then I followed it up with some in English as well, because I know the Dutch are not necessarily the type of people that speak up first. So I figured, well, maybe I should look at this internationally, and I connected with some people in Italy. You have Elisa Parego and Marta Esperti from Long COVID Italy. There were some people from the UK that were already speaking out, and some people from the US as well. And it's not surprising, of course, that the first couple of stories about long-term symptoms are coming from Italy, because the first wave also hit Italy really bad. And yeah, there were lots of people that were describing these long-term symptoms that I was experiencing as well, but not really in the Netherlands. I actually don't think that anyone spoke up around that time just yet. So when I shared my own story on Twitter, I got a response from a Dutch epidemiologist who really wanted to have a chat with me just to go over what type of symptoms I was experiencing and how all of that went, like how those symptoms were developing, because he had been working with Q fever patients years ago when we had a Q fever epidemic here in the Netherlands. And so he knew that there were certain types of viral diseases that had a lasting impact. And that was actually the very first conversation I had with anyone that took my symptoms seriously. And I think we talked about for 2 hours or so. And at the end of it, I was kind of reassured that I wasn't going crazy, for the lack of a better way of describing it. And it really also showed me that there was a real need to keep speaking out about this, to try to see if I could connect with other people within the Netherlands that had the same thing, to try to see if we could reach healthcare organizations, if we could reach hospitals, GP offices, to kind of warn them that this was coming. And so I think I called almost every single hospital in the Netherlands. I called organizations such as the Lung Fund, the Heart Foundation, yeah, you name it, ZonMW that we have as well. To see, like, is there any funding going towards research into long COVID? Like, is anyone aware of this? Is anyone speaking out? And the answer was no, like nobody was, not in our country. And so after that, it took a couple of months for that to kind of pick up steam. And I started getting messages from all types of people throughout the country that were saying, like, yes, I have this too. Like, what do you know? How can you help? But of course, there wasn't anything yet. There was no treatment. There was no help I could offer aside from just monitoring symptoms and just make sure that the people didn't get worse because of things that they were doing that weren't so smart to do when you have long COVID.
I have a question here. It seems like as far as I know, a disproportionate number of long COVID patients are women.
Yeah.
Do you know what the latest knowledge is on why that might be?
I actually don't know exactly. I mean, there are still so many unknowns around long COVID. There are some signs that it has to do with hormone levels. Mm-hmm. But that is also that has been proven that hormones play a role, but not necessarily how big that role is and if it's part of the mechanism behind long COVID. And you say, well, a large, like a disproportionate amount are women. Yes, but then again, when you look at initial infection, there's a disproportionate amount of patients that are men. So it kind of evens each other out, kind of.
Yeah, I did read that men are less likely to report symptoms, but I've also seen long COVID compared to conditions like chronic fatigue syndrome and fibromyalgia, and that there's quite a movement to criticize the way science looks at those kinds of conditions, because they primarily or often affect women and are taken less seriously. I was wondering, can you talk a little bit about this?
Yeah, so true. And this is not a topic that I was familiar with before any of this happened, before the pandemic and before I got sick myself. I knew some things about ME and ME not being officially acknowledged by the UWV in the Netherlands. I don't know how the right way to describe what that exactly is. Maybe you can help.
They're the unemployment office, basically. Yeah. So if they don't recognize your condition, then you can't get your benefits for being out sick, I guess.
Yeah, exactly. Yeah. So that was an issue with ME for the longest time. I think now that is resolved and they do acknowledge it. But can you just imagine having those kind of symptoms and you're unable to work? And they're just telling you, like, no, that's not true. You should be able to work, and we don't acknowledge the fact that you're in pain. I mean, that to me it kind of burst this bubble of my view of the Netherlands. And that has been happening over the last 1.5 years. And yeah, that really has everything to do with how this particular disease, so long COVID, how that is being treated. But also just other chronic diseases. Like, there have been so many people that have reached out to me, people with underlying conditions. I mean, you've heard of the discussion, the No Deadwood discussion. There's so many people with chronic diseases that have been fighting for this recognition and research as well for a long time, that have been ignored or partly ignored. And yeah, there is a real chance that long COVID can be put in that same corner, kind of. that they will try, and they have tried to pass it off as psychosomatic. I think this time it will be almost impossible to do it with this specific disease, just because of the amount of people that are infected and that are suffering from this. And aside from this, I also think that because there's such a need, because the amount of patients, that it will for sure, and already has initiated so much research into those specific symptoms, not necessarily like the label long COVID, they look at the symptoms. And so that'll also have a positive effect for these other chronic diseases, because there's a lot that we can find out because of the overlap in symptoms. So I actually think, first off, I don't agree with all the backlash that has been, that all these other chronic diseases that they had to suffer from. It's really abhorrent that this has been happening for such a long time, and that some people have been refused care for such a long time. But I am hopeful that this will cause this huge shift in how it is perceived within society, and how these people are treated, because now there's no way around it.
And there has been a shift in the Netherlands, partially as a result of the work that you've been doing. Can you talk about the process by which you got this government to take long COVID seriously, and where it stands now?
That's a difficult question. Yeah, so like I said, I've been I started speaking out in July, and helped write some articles about long COVID, but it didn't really pick up steam for the first couple of months. We tried to publish lots of articles from, or like patient stories of how their experience with long COVID had been. We did that through Containment New, which I will get to later. But it really didn't have the effect that I was hoping for. Then at some point, there was a Facebook group that started, but the Facebook group was really meant as a support group. So people weren't allowed to share any medical info on there, or like to share any studies. And what I saw was that, aside from getting support because you are sick, people also wanted to know what was going on with them. They wanted to like keep up to date with all the latest research. They wanted to read about all the different types of treatment options that there were and that were being looked at. And so I figured, well, if I cannot partner up with like a larger group in the Netherlands, I might as well do it abroad. So I reached out to Long COVID SOS, which is also a partner of the Zero COVID Alliance. And with them, we decided like, we have to spread this message. We have to spread the word on long COVID. And they already had this video. It was an English video, basically a lot of people holding up signs saying like, I'm already sick for so many days. Will I ever get better? Please fund the research, and please recognize this condition. And so I've helped them translate it into different languages, and that really started off like the whole long COVID advocacy. But even while working with all these international groups, still something needed to happen in the Netherlands, and that didn't for the longest time until actually March this year. And I was contacted through Twitter by some people that wanted to start a petition. And it was a very generic petition because it had to be that way. So we were asking for recognition, research, and rehabilitation for long COVID patients, and also for patient involvement in research, because that wasn't happening, and the Netherlands isn't really known for patient involvement in research, while it is very necessary, specifically with long COVID. So that petition has been up for a couple of months, and we try to push it as much as possible. Like we formed a work group with 12 people, and we all did so many media requests that we've responded to. We've been in so many papers, like we've been on the on the news, on Evendag, on all these different types of programs, just to spread the word on long COVID, just to keep pushing this petition. And in the end, we reached over 12,000 signatures on this petition. And so when you get to a certain amount, you can officially present it to the Ministry of Health, which we did last week. So we sent them the email. We want to present this petition, and we were asked to do this actually last Tuesday. So we had a round table, like an online round table with different parties. It's almost every party except for Forum of Democracy, of course. And
That would be the far right party here for folks that are not familiar. Yeah,
yeah,
the most far right party, I should say.
and the PVV, they also weren't there.
Okay.
Very unsurprising, of course. And it was a good presentation. We were there with a part of the group. We actually rented a room so we could all be there, like near the Parliament building. And there were some people from our group that were kind of dialing in from home, so that we could still all be there for this very special moment. And because of this, we were also invited to come to Parliament to speak with 2 different political parties. So we were invited by D66 and by the Party of the Animals. And so last Tuesday, we had a great conversation with Vicky, who is actually a long hauler herself. She's with D66, and with Eva van Esch from the Party of the Animals. And yeah, there's finally recognition. There are finally some plans. They were really keen to hear from us what type of ideas we had in how the government should go about this. And I'm very hopeful that this is actually the kickstart of an actual treatment plan and an actual research that could help the patients. There's so many patients that we already have in this country.
As I understand it, the Dutch government says 5 million people, they estimate that 5 million people in the Netherlands have been infected. And they also say that 10% will probably have long COVID, which, according to my estimates, would put it at about 500,000 people. But I also have seen reporting from physiotherapists, for instance, that they estimate around 75 to 90,000 patients. How many people have long COVID in the Netherlands?
Well, the honest answer is we don't know. We do know that there is a lot of people that are not able to get any treatment. You say physical therapists, they can come up with a number saying 70,000, but I'm not one of those 70,000 because I've never been offered physical therapy. So I think that 500,000 is actually closer to the truth than the 70,000. It's in line with the estimates of a country that is monitoring, while in the Netherlands, we haven't been monitoring it and sharing just the numbers that a group of physical therapists are stating. And not all patients need physical therapy. Not all patients get physical therapy. So we really need a better system for monitoring. It's actually one of the demands in our petition is proper monitoring of patients, and also communicating properly about that. Because as you may know, our prime minister is staying mum on long COVID, which of course has a negative effect that people don't know about it, people don't care about it, they're not afraid of it, of getting it. And so, yeah.
Yeah, you mentioned that a lot of patients wouldn't respond to physiotherapy. As I understand it, what is increasingly being found is that exercise is not necessarily good for people suffering from long COVID, and yet this is the most commonly prescribed treatment. If you go to a physiotherapist, they're going to tell you to exercise more, which could make it worse.
Yeah, you're completely right. And it's a difficult thing to comment on, I have to say, because some people do benefit from it, and it's mostly because people lose a lot of muscle strength. because in the initial disease, most people cannot do anything. And because also of post-exertional malaise, that makes physical therapy really harmful in some cases. But it really depends on the case, and therefore I'd also really like to state no two long COVID patients are the same. There are some people in my work group who can do a lot more than I can, and there are people in my work group who can do a lot less than I can. And so in my case, I'm pretty sure that now doing physical therapy will be very harmful, because even now when going for a walk, just a normal walk, not a run, my diaphragm is already playing up. And if that is already happening with a normal walk, then what will happen when you put me on this cross trainer, you know? So it's something that physical therapists should be aware of. At the moment, it doesn't seem that all of them are, but I am hopeful for a more multidisciplinary treatment plan. That is exactly what is necessary. And yeah, in terms of actually getting people that type of treatment that they need, I think it's very important to just listen to the patient, really listen closely to what they say they can handle at the moment, and go from there. It's the only thing we can do.
Yeah. Let's talk about vaccines. There's been reports that some long COVID patients have improved with vaccines. Or I know that you recently got vaccinated. Are you among those who is doing better?
I actually am not, but it's funny that you bring it up because that is my study that you're talking about. So it's kind of funny. I don't think I am among those people that do better, but also it's very difficult to tell right now because I only got vaccinated last week, so I'm not at that 2-week period just yet. And also this week has been very hectic for me, so I may actually come out stronger and I may have a positive effect from it, but let's wait those 2 weeks to actually say anything on the record about that just yet.
Yeah, tell me about the study.
Yeah, so with the study, we wanted to see, first off, if vaccines would be safe for long COVID patients. Vaccines have been tested on people that had COVID before, but not necessarily on people that were suffering from long COVID symptoms. And we know that it's not the same. We know that there are a lot of people who actually fully recover from COVID. And so it's a different set of patients that you're looking at. And I have to say, personally, I was really afraid that that as a long COVID patient, because COVID affects the T cell, that same cell that is now responsible for making those antibodies when we get vaccinated will actually not respond the way that we think it will. And so we wanted to kind of test that, and we also wanted to see if people could possibly benefit or worsen from the vaccines. And this whole idea really came to be because as I'm part of, or founder of the Long COVID Alliance, I should say, I'm really part of a lot of these different support groups, both in the Netherlands and in other countries. And I've been seeing all these messages in my newsfeed of people saying, look, I got the vaccine and I think I'm completely better. I haven't been that short of breath in a long time. And like my headache is completely gone. I'm like, wow, this is interesting. We should look at this. And so started looking around. There wasn't anyone looking at that just yet. So I figured, well, I know scientists. I have great connections with people who would be able to set up a study into this. And so we did. So I partnered up with the Long COVID Clinic in Exeter, Long COVID SOS, and the University of Kent to make a questionnaire to send out basically all over the world. Because it is also really important to look at the different types of vaccine and how people respond based on their race, based on their age, based on the type of vaccine that they get. So it's we really wanted to get an as diverse as possible response. And so I decided to reach out to all the different partners that we have, because we have partners all over the world. So we send it through Long COVID India, we send it through the UK channels, we send it through the South American Long COVID groups. And so we got a lot of responses from all over the world. We got over 800, which was pretty difficult to come by at that point, because countries weren't vaccinating at max scale like they are right now. And luckily from that, we had enough data to analyze it. And what we saw was that about 57% of patients showed improvement of symptoms. We also saw a smaller amount reporting a worsening of symptoms, but that was also such a small amount that of respondents that it really should be looked at more thoroughly. And that's really the conclusion of this study. What we wanted to see is it safe? Are people actually reporting like any serious effects because of the vaccine? Like, not that they're like, we wanted to see just to know for sure, like they're not getting any heart attacks, they're not getting like this or that. And we saw that, well, overall, no, that's not what people reported. What they were reporting was that with some vaccines, they responded very well to it. Overall, they rated their symptoms as being less severe after getting double dosed. And specifically, we saw people having the best effects from the mRNA vaccines, and specifically Moderna. So all in all, again, saying this is a survey. It's a survey that's being shared over social media. So this is not anything like, nobody should make any decisions based on this data. We just wanted to get this data, share it as wide as possible, and also make sure that people are actually studying this more thoroughly.
And what do we know, sticking with vaccines, as you know, now the conversation, as people are increasingly getting vaccinated, now, you know, the focus is on, well, now that we're fully vaccinated, what is the potential for breakthrough infections? And of course, we were quite optimistic about that it would be rare for people to have a breakthrough infection before Delta came along, and even more aggressive variants. And so right now, of course, in the UK, they're going to be reopening, and Boris Johnson is talking a lot about the broken link between infections and hospitalization and death. And what is missing from all of these discussions, not just in the UK, is, okay, so breakthrough infection may not put you in the hospital, but we already know that a lot of long COVID patients never saw a hospital, and some of them never even had initial symptoms.
Exactly.
What do we know about breakthrough infections and long COVID, or do we know anything?
We know that we are now in the most dangerous phase of this pandemic in terms of long COVID. That's really the conclusion of all of it. We don't know yet if the breakthrough infections could still cause long COVID. It seems to be that it is the case, but it's difficult to really make any statements about, because, you know, like I said just now, long COVID is not even being monitored. But like, what makes you think that they're monitoring long COVID in vaccinated people? There's no reason to do that. Speaking from like the world leaders' perspective, I wish they would be looking at this. And honestly, with the organization that I work for, we are looking at this really closely and basically scouring the web to see if there's any studies published, basically day in, day out, because like Boris Johnson, and we both know we can pick Boris Johnson as an example, but I think Mark Rutte could also be the right person here. Like, as long as hospitalizations are low, he is willing to let it run through the population. And it's specifically in these age groups that are not vaccinated yet, or that are vaccinated but only with a single dose. yeah, they're at very high risk to get infected at this point. And they can develop long COVID.
Yeah, I mean, you said you were infected, you developed long COVID at 29. That's you're in the population group that is right now going to nightclubs and bars, who are out dancing with Jansen right now.
Yeah.
And yeah. Should we be concerned about people in their 20s and late teens taking these kinds of risks right now?
Yes.
Yeah.
Yes, we should be very concerned.
Yeah.
And we should mostly be concerned because you say, look, you got it when you were 29, 28, by the way, but yeah, you know, in terms of that, I'm still on, I'm kind of on the older side almost, when you look at the people that are now going out.
Yeah.
But there's also a long COVID kids, or I should say long COVID teens group in the Netherlands that has been advocating for recognition as well. So this is not just people in their 20s, it's teens, it's
Yeah.
children as well. And like you mentioned, the people, the dancing with Johnson, the Johnson vaccine, not Boris, just for the listeners.
Yeah.
I mean, they choose for that. They choose to make that decision to still go out, to do it in an unsafe manner. That's their decision. And yes, you could say like they're not properly informed, and I agree with that. That's still their decision. But the same cannot be said for the children that are being forced into unsafe schools. For them, the decision is made for them. Children are not getting the choice to actually stay out of school. Parents do not get the choice anymore to keep their children home when they don't think it's safe to send them to school. And of course, now we're like, it's summer recess, and it's like parents can have a sigh of relief that for now, for the coming weeks, they won't be pushed to send their children to unsafe schools. But we also know that the vaccines are not yet administered to people under 12. Like it's not yet, do I say that? It's not been approved yet.
Right, proof. Yeah.
The younger ages. And you know, my hope is that will happen soon, and that enough parents will see the possible dangers of COVID in kids, that they will choose to get their children vaccinated. But when we look at other countries, we also see that, you know, the overall idea is still kind of that children don't get severely ill. Children have very little to fear from COVID. And kind of tying that into with that, you know, people that understand the severity of long COVID, not just in the short term, but also the possible long-term implications of that. You know, the people that know about that realize that, are far more likely to choose to get vaccinated. And my fear right now is that there will be a lot of parents who don't see those dangers for their children and will choose not to get them vaccinated, with all the negative consequences of that, because yeah, schools will reopen in September.
And because those parents have been propagandized too for the last 18 months that children don't get sick, that they play little role in transmission. And, you know, for instance, I saw that there was a study in Iceland that said that children transmit the virus about half as effectively as adults. But the problem is Delta is twice as contagious as wild type. So children are definitely going to be spreading Delta very easily. And you're already seeing that reflected in the population statistics for infections.
Yeah, specifically that, I've actually discussed this with my team this week. That really we should be looking at the original COVID, and specifically when you look at how children transmit that variant, and kind of put Delta next to it to see, okay, but do children with the Delta now spread as much as adults did with the original variant? Because that statement could make a lot of waves, to to stay in line with the name of the podcast. Yeah, somebody should be looking at that.
Yeah, and
I'm not sure if it's being done at the moment.
And also we know that, for instance, in Brazil, they had very high numbers of children and babies end up in the hospital and dying. And some of this can be due to differences in healthcare or in how overloaded those systems were. But some of this has to do with a more aggressive variant. And we're really, seems like we're really playing with fire here.
We are.
Yeah. I wanted to move on a little bit. Actually, I wanted to come back to something that you had mentioned earlier, because you mentioned the No Deadwood concept, but actually I don't think that my listeners are familiar. Can you explain what you mean by what the Dutch term for this is, and what is meant by that?
Yes, although I gotta say it still angers me.
Well, that's okay. We're here for your anger on this podcast.
We have this columnist in the Netherlands who writes for a paper, if I'm correct. I have to say I wasn't even familiar with her pre-COVID, so I can't say that I care too much for the person. She's called Marianne Zwageman, and she's the kind of person who likes to push people's buttons. And so when this pandemic started, there were kind of like two groups within society. There were the people who said, look, this is just a flu and we should just treat it like the flu. Only the people with underlying conditions would get it. Only the elderly would get it. And we're okay with that, right? Being the eugenics country that we are. But of course, it's not okay to say that the elderly or people with underlying conditions can just die, and so that the rest of the country can just go on with their lives as usual. That is a horrible thought. That's basically saying that what was the percentage again? It's around like 30% of all people, like the whole population has underlying conditions. Saying that 30% of the population can just die if it's up to her. And she called that, she phrased it as that they are the dead wood of our society and it's time to chop the dead wood. Well, of course, it's a horrible thing to say, and you're not supposed. It's like I'm even struggling to find the words to explain how horrible this actually is. But based on that, a lot of people with underlying conditions, they decide to speak out because that, like, hell no, that they were dead wood. If anything, they had a big contribution to society. They started sharing their stories about their disease, but also just about them as people, because it's ridiculous to think that you only have a place in society when you work full time or when you hold a specific position. I mean, no, this society is made up of different people. Some people work, some people cannot. Some people are healthy, some people are sick. That's part of who we are as a country. It's part of every country.
It does seem, it really does seem to be like an extension, though, of like really internalizing the logic of capitalism, which is like, if you're not productive, if you're not a productive member of society, then you have little social value. And this hits old people especially strong. I think, this concept of the completed life in the Netherlands is also something a little bit surprising to me. That people don't, that they sort of reach a point where they're done, and that's not an internal decision that's made. It's one that is sort of imposed upon them by social norms. Yeah,
if only they felt that they were done. But it's like other people are saying, well, you reached a certain age, you should be done.
Right. And as I understand that, that's also baked into like health insurance formulas. It's like, well, if you don't have a statistical likelihood of having a long life, then maybe you will be denied certain forms of medical care and treatment.
Exactly.
Yeah.
And thereby just expediting it, right?
Yeah. This pandemic seems to have exposed a lot of these things that are under, just under the surface of the way things are done all the time.
Yeah,
I was also like, I mean, you mentioned this one columnist writing, calling people dead wood, but of course that's part of, I mean, there's a kind of eugenicist streak in a lot of uh, uh, public thought, right? There's
yeah,
also
a
the
lot.
science editor for the Volkskrant, Martin Kuhlman's his name.
Elements, yes.
Kuhlemans, yeah, who it has a quote from a eugenicist in his Twitter bio, and basically wrote stuff during the early part of the pandemic saying, yeah, well, like what you said, it basically only affects old people, fat people, people with underlying conditions. And this kind of minimizing, kind of explaining away people's deaths and disease as implied as sort of a function of their own moral failings or their own inability to
Exactly.
manage their own healthcare.
Exactly. And it also is so, it set the tone for how the rest of the country should be thinking about this. And that, I think, I may never forgive him for that, because ever since that, if people lost a loved one due to COVID and they shared that on social media, what was then the first response from people is, did they have underlying conditions? As if they had underlying conditions and them then dying didn't matter.
Yeah.
That's not a way to treat people. And also, what is an underlying condition? If someone has asthma that they could like live to 100 with, then is it okay if that person dies at 30, 40? What is then acceptable as an underlying condition? I have sun allergy. Is it okay for me to die? Like, where's that line? And also, why are we drawing a line? I never understood that, and I think it's abhorrent that there is such a large part in our society that is even able to think about other people that way, that think they're entitled to talk about other people that way. And the thing that I may actually be most sad about is that media outlets keep giving them a platform. Like, we cannot get out of this mindset if the media is constantly fueling it.
Yeah. You also work for, you're an organizer for the Zero COVID Alliance. First of all, what is Zero COVID? What does that mean?
Well, the Zero COVID Alliance. Yes, I started the Zero COVID Alliance in August, and that was mainly because as a small country, we didn't think we would get very far with our Dutch platform Containment Nu in terms of raising the alarm internationally. So that's why I started it. We called it the Zero COVID Alliance because basically with an A-level disease such as this one, containment is what is recommended. It's actually law. Like, you can look up you can look up our own laws on public health, and it actually states like it gives some requirements of how we should go about that as a country, how our Ministry of Health should go about that. And it basically says you need to contain this virus, you suppress it, you go to a low amount of cases and you trace every single one of them, so you can like basically fully contain an outbreak. You break every chain of transmission. And so that is the way how you go to zero COVID. And if you have zero COVID, you're able to open up. Now, I'm fully acknowledging that zero COVID is kind of out of reach, because this is so widespread. This is worldwide. Like, we have millions of new cases every day. So that is not something that you can just say, oh, we're going to go to zero and we're not going to be content with anything more than zero. Like, no, that's not it. But it sets the goal of going to that low amount of cases. And honestly, that hasn't been the goal in so many countries. And so with that idea, and also with the work that we did with Containment Nu, kind of with all of that in the back of my mind, I figured, well, we're just going to try. We're just going to start this international platform because we cannot be the only ones out there actually going against the grain, speaking out about what our government is doing, speaking out about people in high risk groups and long COVID and healthcare workers. And turns out we weren't the only ones.
Yeah.
But you probably have some questions. So
Yeah. Well, let's talk about containment news. So first of all, just to give some background, I'm in a risk group. So when the pandemic started, I decided I was going to have to get used to spending a lot of time at home, and spent a lot of time on Zoom and meeting with friends carefully outdoors and parks and things like that. But I felt very, very isolated in terms of finding people who shared my feelings about the pandemic and the Dutch response to the pandemic. And so my first big time, like my first time really venturing out of the house was to go to Containment News, or Containment Now in English, right? Vigil last summer for those lost to, well, I also went to the Black Lives Matter protest, which I think was also in that month. I think they were both in June, if I remember correctly. But these were both my first like reintroduction to Amsterdam crowds and to Dutch society. And that vigil, I brought a friend as well. Was really meant a lot, excuse me, a lot to me. And I got to meet you. I have to say that was the first time where I really felt like, oh, there are other people who care about this. There are Dutch people who care about this. And that was really a change for me. And the care with which you all arranged that activity and everyone wearing masks and stuff when there was no expectation that we should have to, really meant a lot. So yeah, maybe you could talk a little bit about your work with Containment Now, and how it evolved into what you're doing now.
Yes, would love to.
Yeah.
Also, just to comment on that, that's very special to hear that even though you had been isolating for so long, that you felt that this was a reason to get out again and to be present. Yeah, I feel the same about that specific event. And just for the listeners, we set up a vigil in which we wanted to light 10,000 candles, one for every COVID death in the Netherlands. And it turned into a beautiful interactive event because we brought all these wax lights. But they wouldn't stay on. They kept, like, there was a lot of wind, and so the wind kept blowing them out. But because of that, it kind of gathered a crowd around the area, and people started asking if they could light a candle. And so we've had people going in and out of that little square and lighting their own candles. And some people took a photograph of their loved ones, and we held a moment of silence. And you share that it was kind of special for you, but for me personally, that was the first time I could hold my own moment of silence. And of course, yes, my dad had underlying conditions, and I will never be sure if it was COVID, but that was the first time I could take a moment to remember my dad. So it was really special for me as well. Yeah, kind of a comment on that. But yeah, with Containment New, like I said, I joined Containment New in July. That's when I started reaching out to them. So the vigil was a little later. I think it was in August, maybe.
Okay, yeah, maybe, yeah.
But yeah, there were Jaap Strongs and Michael Blok. They were already at it since March 2020. And they've been doing a great job. They wrote a plan for elimination, basically wrote out every single measure that we had to have, but also stated just like, these are our laws. This is how we should go about infectious diseases of this kind. And they set up the website, right? The containmentnu.nl. And you could find all the necessary info on there. So about face masks, about quarantining, about infection risks in children. And I felt that there was one thing missing from their advocacy, and that's long COVID. They didn't know about it yet. They didn't know how severe it was. They didn't have any patient involvement. And so I reached out to them saying, look, this is a big part of what is happening. It will become an even bigger part if I'm right. And so they let me in and joined the group officially. So I was the designated long COVID person within Containment New. And I started sharing like my own story on there. We wrote different types of articles, not just on long COVID, but we've also really focused on schools for a long time, because our mindset was, look, if people choose to go out without a mask, that's up to them. Like, we knew, like, anyone with half a brain or willing to Google would know that a mask is effective from protecting yourself against a viral disease, an infectious disease. But if adults go out without a mask, sure, that's their responsibility, but children didn't have that option. Like, they were just sent into these unsafe schools. There was really no talk about how kids could also get sick, how they could transmit. There was even this, oh my God, faulty study being published that was actually coming from the Netherlands by some of our outbreak management team, connected scientists who did some study into the transmissibility of kids. And it went it did the rounds. It was shared all over the world, and it basically said that children barely transmit. They're never the index patient, and based on that, schools were kept open in an unsafe manner for a very long time. And of course, we knew that there were such simple things that schools could do to keep teachers safe, to keep parents and children safe. So we decided to make a schools pack. We reached out to a lot of schools. I think at one point we even sent out a mass email to like all the high schools that are in the Netherlands to basically share all the information that there is with them. We printed flyers with information on schools that people could basically order through our Twitter if they wanted to hand them out. But it wasn't enough. Like, we were sharing with thousands instead of hundreds of thousands. And so the information didn't get to everyone. And so schools were kept open. Some parents knew they wanted to keep their children at home, and they did, and were met with a lot of hostility from the state, basically being forced to send their kids back to school or be sued, prosecuted for unlawfully keeping their children at home.
And you all went to court over this.
And we went to court over this. Yeah, I realize now, like, so much has happened. We really should have sat down earlier, because I feel like now so much has happened over the last year that I keep like rambling to even go over all of it. But yeah, we took them to court. I mean, it was one of the things that we felt really strongly about, like I said, because look, children should be protected. It's actually law that children should be protected. Because they are vulnerable. Like, it's up to the parents to make those decisions for them. And one of the things that we asked for in the lawsuit was the removal of misinformation from the RIVM and government website, which was that children do not spread the disease, and they don't get very sick from it either, which we know now is not true, and specifically not when you're talking about long COVID. We wanted parents to have the choice to keep their children at home, so to decide for themselves which level of risk they deemed acceptable for their children to be in. And we asked for either masks or social distancing in schools. well, these are very like bare minimum demands, because we already knew like masks or social distancing won't do much good. You need both. You
Yeah.
need both and ventilation, and you need actual tracing. And but sadly for us, that's not how the legal system works. You have to make it very clear, very specific and simple. And otherwise, there's a real chance that you won't be able to win at all. Well, before the lawsuit started, we already managed to get the misinformation removed from the government website. Masks or social distancing, they wouldn't give us, because that was based on the WHO, and the judge ruled that that RIVM is also an authority that should be listened to, and if they stated that it wasn't necessary, well, we should go with that. Like, we don't make the rules, like we don't make the science, kind of was the statement. But the judge did take time to write a separate paragraph that stated that the state should be sensitive towards parents that were fearful of their children catching COVID. So in other words, don't prosecute parents.
Okay, so just so we're clear for international listeners, in the Netherlands, because this is different in the United States,
Yeah, good call.
schooling is compulsory. So if you don't send your kids to school, you can be fined, you can have your children taken away from you. So what you got from this judge was that these people could not be, prosecuted or fined if they had concerns about their kids being in school.
Yes, exactly. Or for if they already were kind of prosecuted, that these lawsuits would be dropped.
It was reported just today, or maybe yesterday, that it was reported that the Netherlands is going to drop the requirement that children under 12 with cold symptoms have to stay at home.
Yeah, fabulous, isn't it? So long COVID in kids is really ignored, even more than it already was. Now, this is like, you probably want my reaction to this. This is ridiculous. This is actually ridiculous, because we know that children present with other symptoms, mostly less severe symptoms than the initial disease, and specifically those symptoms that they say that if children present with them, that they shouldn't get tested anymore. Those are specifically all the COVID symptoms.
Yeah.
How are we able to pick up on COVID in kids if we're not allowed to get them tested?
Yeah, and we also know that it appears that Delta specifically is more likely to present as a cold than the earlier variants. I also was just struck by how strange that was. I mean, I know children often have runny noses and things like that, but I was thinking, even without COVID, why isn't it a good idea to keep your kid home when they have a cold? Like, I was confused by this whole mentality, which is like, oh, well, my kid has only got an infectious cold, so he can still go to.
Yeah, but that's like the ironic, ridiculous thing of all of this, is that parents say like, oh yeah, these, like, we should really drop these measures because kids are always sick. I'm like, yeah, why do you think your kid is always sick? Because parents always send their sick kids to school, because resulting in kids always being sick.
Yeah.
You can break that chain of infections as well.
Yeah.
May actually be better for everyone involved, especially their grandparents, also when it's just the flu.
Yeah. So we talked about containment. We talked a little bit about Zero COVID Alliance. What's next for you personally?
What's next for me is a little bit of everything, honestly. I mean, I've been trying to juggle it all. Sometimes that went better than others. But this pandemic is not over. Like, our work with Containment is not over. There are still people that are uninformed, that are still people that that should be like you said, well, this is kind of like an archive, to look back on this pandemic at some point. That's also what Containment New is. We've actually had our website archived for the Royal Library a while back. So everything happening now, all the like every scandal that we've been talking about for over a year, they're all coming out now, but now in the papers. So I mean, it's mean to say it, but it's almost nice to see it come out now, because we were being ridiculed for so long, and like people were saying, like, no, it's not true. You're just like fear mongers, and but we
Right.
know that we had been right all along. So
It
it's
keeps
kind of
happening like that, like 3 weeks ago, we said Delta's coming, don't relax the measures, and now it's here. And the temptation to say, we told you so, is quite high. And
exactly.
especially high when you've been gaslighted for a year and a half that you shouldn't worry about any of these things.
Exactly. So yeah, I have a hard time with biting my tongue on that as well. But hey, nobody likes a know-it-all, I guess. So we just keep fighting the good fight, keep informing.
But Vicky, I'm sure you agree with me. I would like to be wrong. Like I would.
Oh, I would love to be
I would
wrong.
be very happy to find out that that we're going in the right direction.
Yeah, but that's with all of these topics. I would have loved to be wrong and actually like hear that I am the only long COVID patient in the whole wide world. If only that were the case. But yeah, our work with Containment New, I mean, we have a lot of work still ahead of us. I mean, right now, like you said, it's like it's last year all over again. So that means that we have to do our work like last year all over again, because we have to reach people that we haven't reached before, and even some people that we did reach that are now also easing their own kind of implemented measures because they deem themselves completely safe, while we know that they're not. So that will just go on, and I don't know for how much longer, but we'll see. And the same goes for the work with Zero COVID Alliance. I mean, with Zero COVID Alliance, the work that we do is a lot broader. It's not just advocating for zero COVID. We've been focusing on different topics. We've been focusing on the vaccine patent waiver. We've been focusing on the sharing of mRNA technology and trying to influence world leaders to set up these mRNA technology sharing hubs. There are so many different aspects of this pandemic that are kind of like underreported. So we work with people in high-risk groups. We work with unions to get the right measures implemented, or to get proper care for sick people. Like there's still like so many different sectors that had a lot of people get infected over the last year that are not able to get any treatment or even sick pay. And so there's always work to be done. And then of course there's the long COVID work, which won't stop anytime soon. I mean, that's for Long COVID Netherlands. As a work group, we have a lot more work to do, but also internationally. Like in the Netherlands, Long COVID is now being acknowledged, and the same goes for Italy, Belgium, if I'm correct, and the UK, and the US now. But as for every other country around the world, that's not the case. So if they're not going to do it themselves, if their people, like if their population, if they don't have a support group, if they don't have an advocacy group, we will do that for them. We will reach out to those people and try to see how we can help them. You know, we've even been working on getting a long COVID group set up for Native Americans, because turned out they were being overlooked in their own country and nobody reached out to them to see if they needed help. So there's a lot to be done. And that's the thing with the Zero COVID Alliance. People are a lot of times kind of confused by the name. They think it's just advocacy. I think it's just like people demonstrating, but that not nearly covers everything that all our partners are working on. So in terms of just COVID work, I mean, we always explain it as we support every single COVID effort that there is around the globe. And it really is as broad as that.
Yeah, and it really does. It does seem like I mean, I think we used to think, and I consider myself an optimist. I
Mhm.
did think that there was going to be a sort of definitive moment where the pandemic ended, and I no longer think that anymore. I think we're going to have as vaccines start to reach the rest of the world, we're going to have a sort of fade out or something. But it seems like even while we push for zero COVID, we're going to end up with an illness that is endemic, that is worse in the fall and winter, and that is similar to the flu, but probably more damaging. And so a lot of the things that you're talking about are about building long-term structures in our societies to address them, right?
Yeah, because that's really what we've seen throughout this pandemic. It's not just people why all of this went so wrong. It's because we've seen now how people are interconnected.
Yeah,
We now know that if there's one person with one disease in a classroom, the whole classroom will have it within that day. We now know that if you share, like if you work in this office that has 30 stories and you share the elevator with someone that goes to the 21st and the other one goes to the 30th, within the week, all 30 floors will have it. And then that's not something that our society has taken into account with building, with ventilation. So in terms of what this pandemic has shown us, we're all interconnected as people and how we are socially with each other, but we're also connected through the buildings that we all work in, that we walk through. Like supermarkets, great place to get infected. Now that we know that, we can act on that. And also just in terms of preventative measures, like we've seen with this pandemic how fast it can go when it's just in one country, but due to these open borders, it can spread from one country to all over the world within a month. We know that now. And so we know how to respond to that the next time a pandemic comes around. At least I hope we learn enough from that to try to prevent it the next time around. And that'll be one of my main focuses, like how can we take the lessons that we've learned throughout the last year and actually implement them for kind of a better tomorrow. There's a lot to be done.
Vicky, thank you so much for the work that you've been doing on this issue, and thank you for talking with me today.
You're so welcome.
I'm glad we got to meet finally without masks.
Me too.
Yeah. That concludes my interview with Vicky van der Togt, which was recorded on July 8th of 2021. If you would like to find out more about what Vicky is up to, you can follow the Zero COVID Alliance on Twitter. The Twitter handle is Zero COV Alliance. And if you would like to follow her activities with Containment Now, you can follow them on Twitter at Containment Now, or in Dutch, Containment Nu, NU. I want to thank Vicky again very much for talking with me today, and thank you all for listening. I'm going to be taking a month off finally to visit family and friends in the United States. I realize that I'm taking this break at what is possibly one of the riskiest times for the Netherlands, with the Delta wave currently sweeping through the country, especially in its cities. So I want to encourage everyone to look after themselves and each other, continue to practice social distancing, wear a mask when you have to go indoors, and hopefully we can get through this together. You've been listening to Breaking the Waves, conversations about the Dutch pandemic.